So over the last 8 years, I've been overseeing a home health and hospice company. And within those 8 years, I've probably fielded over 500 hospice 101 calls, which is a lot. And it can be scary when you hear the word hospice. And so our team, we were talking, we were like, why don't we just re-simulate or recreate that and basically have someone like Rafia act like her mom needs hospice care. And so during this conversation, it's going to be a phone call. And over the last 500 or plus more hospice 101s we've done, we tried to create some scenarios that you can relate to. So if you or your loved one needs hospice care, this video will allow you to kind of take the first step and also ask that hospice some of these questions so you can get a thorough understanding of what to expect. Hospice is a good benefit. It's a great benefit of care for your loved one and for you. And so we hope this helps you, and we'll see you in a second. Oh, let's see who's calling. Charlin Health Services, this is Charles.
Hi, Charles. My name is Rafia, and I was just calling because I was told by my mom's doctor that I should reach out to a hospice agency.
Oh, wow.
Actually, I was referred to you guys by a friend of mine, but I'm just not sure what that process looks like, and I want to know more about what hospice care is.
Oh, wow. Yeah, no. That's wow. But how are you doing? Like, how are you doing? Like, just overall right now?
I'm doing good. It's just a little bit overwhelming right now, but overall I'm okay. Just,
Yeah,
want to know more about this.
yeah. Well, hey, first of all, thanks for reaching out. We're here to help. I know it can be kind of really scary when hospice is used, especially when it comes to your mom. But if you would like, I can kind of walk you through, what hospice is, what it isn't, and how it can be like a benefit and a support for you and your mom and your family. Does that sound okay?
Yeah, I would appreciate that.
Cool, awesome. Well, just if you don't mind, just tell me a little bit like about your mom, just in general.
Yeah, so my mom, Tina, was diagnosed with heart failure
Hmm.
about 5 years ago. Yeah, 5 years ago. But in the last year, she's really just declined.
Hmm.
She gets out of breath just by like walking around the house, and she's pretty much attached to her oxygen tank all the time now.
Oh, wow.
Um, what else? She's been in and out of the hospital 3 times in the last few months due to fluid in her lungs and then pneumonia. And her diabetes has been all over the place.
Hmm.
I just don't know. I feel like no matter what we do, she's just getting weaker, and she just sleeps most of the day, barely eats, has no appetite, and she just lost so much weight, and we've just been so concerned.
Oh, wow. Wow. Is she, are you, is there any extra like support at home? Is it just like you and your dad, or who else is there?
Yeah, it's just me. I'm an only child, so
Oh,
I'm
wow.
the primary caretaker.
Oh my gosh. So you're doing a lot, right?
hmm
Oh my gosh. Wow. Is she, her PCP, you know what a PCP is, right?
No, what's that?
Yeah, so her a primary care physician. So basically, like her
Oh, okay.
main doctor has
hmm
when's the last time that she saw like her main doctor? Was that the doctor that referred hospice care for her?
Yeah, so I think it was about maybe 4 months ago,
Oh, wow. Okay.
but we do a televisit because she's at home.
Oh, okay. Okay. Wow. Okay. Okay. There's where do you guys live? You guys live like not too far from Plano, or?
Yeah, I'm right in Allen.
Okay. Cool. Okay. Nice. Nice. Specifically, like, what are some things that you do know about hospice? I know, like, when the doctor said hospice care, what are some thoughts that come to mind so I can kind of walk you through it?
Yeah, I mean, I just don't know much about hospice. I just know that if there's a decline, then you get referred out to that. But
Hmm.
honestly, I just hear really bad, there's a bad stigma around it, so that's why I'm afraid.
Yeah. Okay. Okay. Is there anyone like currently at home, like from a nursing standpoint? Like, is there any home health that's there taking care of mom, like a nurse or a PT or anything like that?
No, there's not.
Okay. Okay. All right. So yeah, let's break down just like hospice care. So, does your mom does she have Medicare?
Yes, she does.
Okay, great. Does she have like a Medicare Advantage plan, like United Healthcare, Aetna, Blue Cross Blue Shield, or just traditional?
Yes, she has a Blue Cross Blue Shield Medicare Advantage.
Okay, great, great. So what happens with hospice? Hospice is covered by Medicare, and so
Hmm.
Medicare covers that benefit of care. And so the doctor, your doctor, mom's doctor, sent out the order for hospice care to get started. And so what happens next is that usually like this phone call will happen. We'll walk through what hospice is, but within hospice care, your mom can get a lot of things to support her and your family through this process, right? And
Hmm.
so the first thing is a clinical team, right? So Medicare covers a nurse to come out, an aide to come out, a chaplain who's coordinates with spiritual services, and then also a social worker to help and to come out with wills, DNR, medical power of attorney if needed, all those things. And so you have like basically a team to kind of help you, your family, and your mom go through this disease process together, which is it's a great support. It's a great help. So that's one of the benefits.
Hmm.
Second thing is medication management. So depending on how she's doing, you'll have the hospice cover specific medications and then be the one to kind of be the main point of contact for those medications, which kind of helps in terms of like going back and forth to different doctors, different specialists. You kind of have one point of contact. Um, and then durable medical equipment. Are you familiar with like DME, like hospital beds, wheelchairs, walkers?
I'm familiar with the walkers,
Yeah.
but other than that, I don't know anything of what can get covered.
Yeah, so those are all covered under hospice care. So usually it just depends on, what your mom and your family needs, but the hospices provides that, and they kind of tailor it towards the needs and of what your mom may need. So, and then also another thing that's really really helpful are supplies. So supplies in terms of like incontinence material, wipes, gloves. There's so many different things that you don't have to pay out of pocket. The family doesn't have to pay out of pocket for, which is super helpful. So I know that's a lot of things, but those are things that Medicare covers that helps family support in this season because it's a lot. You guys are
Hmm.
going through a lot. So um, that's kind of like in a nutshell what hospice is. But then there's also different levels of care.
Hmm.
But one of the things that I think you may ask is like do you get round the clock care for hospice care, right? And yes and no, right? So depending on how your mom is doing, if she's fairly stable, she's doing okay, then the nurse will come out like twice a week, right? And maybe the aide can come out 5 times a week, but usually that's like you know 30 minutes to an hour just for bathing, right? So
Hmm.
you're gonna have some spaces between that care with what is covered by Medicare. And sometimes we see families like pay private pay for a caregiver to kind of sit with your mom or help, right? There's certain things, but you do want to utilize as much as you can through the Medicare benefit of hospice. But within those gaps, there's still, maybe extra help that may be needed, to kind of relieve you, right, and your dad and your family from the caregiver burnout that can happen. You know what I mean? Um, so those are some areas that we see a lot. But later on, down the road, if she needs 24/7 care and her disease is progressing, then there's some little basically checks and balances that the hospice has to make to warrant a nurse at the bedside. So, but that's usually
Gotcha.
usually like when there's a huge need for that. So, um, I know there's a lot. There's a lot of information, but what are some questions that you may have, like specifically based off of that, just in the hospice in general?
Yeah, no, that was really, really helpful.
Mm.
One of the questions I have is, so insurance will pay for all of this, correct?
Yes, insurance will pay a cover. So Medicare, as long as she has Medicare, it'll cover all those services that we mentioned 100%. So
Um, So, what if my mom's symptoms get worse? So, if there is like a major decline, like how will your team go about that? What clinically, um, if you can touch on that a little bit.
Yeah. So really, you're looking at there's different levels within hospice care. So you have the ability for hospice to be at home, right? Um, to basically cover the care that's at home. So a nurse can be there as she declines and as she gets more of a need, the nurse will increase the amount of visits, right? So
Mm-hmm.
it could be daily visits. And then if it gets to the point where, the family's not able to support um, her in her disease process, then that's where the continuous care is warranted. So where you have a nurse that's at the bedside 24/7 until her symptoms stabilize. And then sometimes, if it gets too overwhelming or if it's too much, we do see families, transition into a skilled nursing facility, right? So where, your mom will go to a skilled nursing facility just because, we've had families where like, you don't want mom to pass away at home, right? It's kind of, it can be hard, right? So we've seen that as well. So it's really based off of the goals for you and your family and how you want that support, in her last days. But you do have that clinical support and guidance from a nurse and also from the medical director who oversees the care. So it's a great question.
And then, so how do we get started now? I am interested, and I just order the first steps. Like, how do we get started with hospice care for my mom?
Yeah. So the first step is, your doctor, I think, mentioned, considering hospice care. So what the doctor will do is then just fax over an order to our agency, and on that order it'll say, it'll have the your mom's demographics, right? Demographics are just like date of birth, first name, last name, insurance information, and then the last kind of progress note or the last information that he or she saw when they saw your mom. And so they would send that over in a fax to our agency, and then in that order it would say hospice, evaluate, and treat. That gives us the ability to start, right? To start the process to kind of get going. So once we get that order, then usually our hospice team, intake team will call you or the main contact and just kind of get them to verify, right? Verify, address, make sure the address is the same because sometimes the doctor could have a different address if you moved recently, and we just verify that and then just kind of what we've talked about. If they haven't talked to you before, they'll probably ask some of the same questions, just to kind of get a feel for mom and her history, maybe like what was her occupation, what does she love, what does she like, and get to know her. Does she go by Tina, or does she have a different nickname? Kind of get a good understanding of, because we're here to be guests, to help through the process. So that would be the step, and then they would schedule a nurse to come out and do the initial assessment. So that RN is the one who kind of gathers all the information, does a head to toe assessment, reviews vitals, kind of the plan, the game plan, making sure that everyone in the family truly understands what hospice is, right? So, once you start hospice, we've had families, get off of hospice, right? What that means is the patient is getting better, right? But once you're on hospice, you do agree not to, basically seek more, aggressive treatment, right? So chemo or um, surgeries that are trying to progress, and keep you going. You're really trying to focus on comfort and keeping mom safe at home and not going back and forth to the hospital. So, and that's really the goal. So that's where that admission starts. And then the nurse, you, and the family and the patient develop a plan of care. So that plan of care basically says, okay, nurse, I'm going to have you come out, 2 times a week. I'm going to have the aide come out 3 to 5 times a week, the chaplain once a month, right? You guys create something that works for you. And then, you're ordering medications, reviewing medications, and the equipment that we talked about, ordering what equipment you all need. And then, you have the ability to call the hospice number 24/7. You'll get someone live. If someone needs to come out or they need a triage over the phone, you have that clinical support sometimes in the middle of the night. Mom may be having some aches and pains, and you need to know, what do I do? You can give us a call. That's what we're here for. So, but no, that's kind of how it starts. Does that kind of help paint the picture a little bit?
Yeah, that definitely makes me feel a lot better. And so she's been in and out of the hospital 3 times. So I just want to
Wow.
reduce that and make her feel comfortable at home with us.
Yeah.
So,
No, that's good. That's good.
well, I appreciate that. Thank you so much. And I learned a lot. So
No, yeah.
we'll keep in touch.
Yeah, thank you for reaching out. Like I said, I know it's scary, but hospice is here for you. Hospice is is there to be with you and your family. So I appreciate you reaching out. But let us know if you need something.
Awesome. Thank you so much.
All right.
Bye.
Have a good one. Bye-bye. Hey, this is Charles with Charlin Health Services. Hope you enjoyed the video. Please remember to like and subscribe. We hope this was a blessing to you, your family, your loved ones, all your friends. Share it. And if you want to watch more videos, here they are. Enjoy, and we'll see you guys next time. Peace.